Hi there, it's Dr. Yum, and I am here on the day of the Yumathon with a very special Dr. Yum project partner. Now, for those of you who have tuned into the Yumathon before, you know this partner very well. Dr. Sudeep Menachery is a friend and Dr. Yum project partner from Hematology Oncology Associates of Fredericksburg, which is one of our original partner practices that helped us launch our work in the Fredericksburg, Virginia area and beyond. And I'm excited to have you here, Sudeep.
Thanks. I appreciate it.
Dr. Menachery joins me every year, and we were just saying it's a little different this year. We're not cooking, but it's more of just talking and chatting and catching up. All right. So first of all, welcome. It's month 8 of a pandemic. I know things have changed at my practice. I'm sure things have changed drastically at Hematology Oncology Associates. Tell us what's going on in your world.
Well, a lot. Well, I think the biggest thing that we worry about as oncologists is sometimes the isolation that's been associated with the pandemic. We did slow down initially at the beginning of this in March and in April, and we were trying to decrease the foot traffic in that practice. We were doing a lot of telemedicine, but obviously, as you can imagine, for those patients that are undergoing active chemotherapy, that's not really something that can stop. So this was obviously considered very much essential. So we were still kind of full steam as far as giving chemotherapy on a regular basis. I think as things started to open up a little bit over the summertime, we started to have more patients coming into the office, and we're seeing them. But as you can imagine, we're all wearing masks when we're visiting with patients. But I think the biggest thing that's probably impacted our patients is a little bit more of that isolation. They don't have, sometimes their friends or their families that often get together with them and providing that psychosocial support.
Right.
So I think there's a little bit more of an isolation component. I think for all of us, but from our cancer patient population, I think that's been a little bit more so than normal.
Yeah, it's really interesting to hear you say that. In pediatrics too, we're feeling the effect of the pandemic in terms of the mental health of our patients. And kids may not be able to verbalize what's going on as well as adults. So they come with behaviors that are confusing to the parents. And I think a lot of it stems from the isolation, the loss of routine. So we're finding ourselves being mental health providers
Sure.
as much as we are medical providers. And it's just what people need right now. It's a very
Yeah.
strange, isolating, confusing time.
Yes.
So, yeah, I'm glad. Do you have any specific strategies for your patients in terms of battling that social isolation?
I mean, I think the most important thing is people have now sort of adapted to their quote unquote their bubble
Right.
of family. And I think a lot of them are very much motivated so that they're really sort of limiting each other's outside contact just so they can be with their loved one as well. So I think everybody's trying to do their part. It's challenging. I mean, obviously patients of ours that do still sometimes need to go to work and they can sometimes work from home. But then, there are kids or grandkids that sometimes are involved, and, some are going to school, some are distance learning. So
Right.
a lot of challenges. And I'm sure, once again, other fields of medicine are facing some of the same things as well.
Right. Right. I was thinking too, early in the pandemic, families were nervous about coming into the office. In pediatrics, we really wanted to keep seeing kids, keep them immunized, make sure that they are meeting all of their milestones, all the things that we do, but parents were nervous about coming in.
Yeah, sure.
And so we really had to do a lot of reassurance. And I wondered in your field, so much of, how I think about oncology is screening, right? And early detection. for us, it's early intervention. And so seeing kids on a regular basis and seeing your patients early is so important. And I suspect that, one of the things families were doing or patients were doing is maybe delaying their screenings, coming into you a little bit later because they were nervous about coming in. Have you seen that?
Um, I think I've seen a little bit and heard a little bit. I think there's going to be a lag effect to some of that.
Right.
Even as I'm seeing some of my patients from the hematology perspective that don't have cancer, and I'm saying to them, hey, you know what? You're overdue for your mammogram or you're overdue for your colonoscopy. We need to get you in.
Right.
There's been a little bit of fear as far as doing that. But here we are, like you said, about 9-10 months into this pandemic, and I think that we'll continue to see sort of a lag in the next, whether 6 months or 12 months, where some of these cancers that could have been caught at an earlier stage or prevented altogether, come to fruition. So we are a little bit fearful of that.
As an oncologist, do you have any words of advice for people who have screenings that they should be doing and are still a little bit nervous?
Yeah, absolutely. I mean, I think that there are, I think the healthcare system, especially when I think about mammograms, right? They're taking all of this very seriously. They want to get their patients in. They want to make sure that they get the mammograms, ultrasounds, and or biopsies needed in a timely fashion for things like screening colonoscopies. If there's a fear, there's actually like a stool-based test. There are some options that can be done at home. It's not perfect, but at the same time, it's something. And so if there are some people that are, once again, just so fearful to go out or go get a procedure done, there may be other things that can hopefully have, tie them over until the proper evaluation can be done. I think continued communication with your, healthcare provider, your primary care doctor is a key component of that, your GI doctor, et cetera. But just keeping communication lines open. So what are some other alternatives?
Good to know. I know I personally have delayed a few screenings, so it's good to hear from the expert that we should continue to march on and take care of our health.
Absolutely.
Maybe in slightly different ways, but still not neglecting our health. I know one of the things that we love about your practice as a Dr. Yum Project partner and supporter is that you really do believe in the power of good food and diet. And so I wondered if you could speak to, why you've been a supporter all of these years. And full disclosure, Dr. Menachery's wife is one of the founding board members. But besides that little detail, why is it that you and your colleagues have been such great supporters of the Dr. Yum Project and our work all of these years?
I think a lot of us as oncologists, when we practice, I mean, it's kind of head to toe. It's just, mind, body, and soul. It's a little bit of everything. All the little cliches, garbage in, garbage out type of thing. So we got to take care of our body. We frequently get asked about diet when patients come in with a diagnosis of cancer, and then we're starting to sit there and talk about, okay, you need to undergo chemotherapy, or you need to undergo radiation, or you need to undergo surgery as well, or the combination of all three in some way, form, or fashion. We do know that healthy eating, healthy living can help some of those treatments along better, manage side effects. And I think that there's definitely a motivation as far as trying to do better for themselves. And so we want to try to enable that. We want to try to help them succeed. As you probably know, especially from the smoking perspective, they're usually life-changing events that really sparks somebody to quit smoking, whether that be the diagnosis of cancer, heart attack, stroke, something like that. So if our patients are coming to us and asking about healthy living, healthy diet, we want to be able to, try to funnel that energy very constructively to help them succeed. A lot of what you guys have done as a program and is you've attacked this as a family, not just necessarily as an individual. You guys realize that it's a unit. Especially you guys started off as sort of targeting more children and pediatric population, and then sort of expanding that towards everybody. And I think it just makes such perfect sense. And even if we have patients of ours that are adults and that are motivated to eat better, maybe that will also translate into their kids or their grandkids or something. As we've looked at the Dr. Yum website and looked at the recipes on there, the recipes continue to grow, and there is a diversity of things, and we can really sort of endorse all of it. There are a couple of things where some of our patients maybe vegan or vegetarian or gluten-free, or but for the most part, it's not that you got to stick to one category if they have a very broad diet, and so they can really sort of try a lot of different things. So it's been helpful. I think the diagnosis of cancer, it's very just overwhelming.
Challenging.
To be able to guide them towards something like a website um, is very reassuring, because the conversations that we have are pretty heavy in our office, and so it's just yet another thing that they're trying to absorb. But I can say, hey, you know what, when you get a chance, we'll actually show the website in the office, in the room, but then they'll sort of take it down, and then they can go home and play around with that. Me personally, as I get older, I mean, I was the kid where, I was sort of like the gym rat, and, was always outside playing and, exercising, sort of say, and didn't watch really what I ate. But now, like, it's sort of getting to the opposite. I feel like I'm exercising less and I want to do more, but at the same time, I do need to watch what I eat and be a little bit more aware of that and how it affects my body in other ways as well. So I think it's all in all, once again, the term I use is garbage in, garbage out. We got to take care of ourselves moving forward.
Well, I love that in your house too, it's a family effort led by Dr. Nair, your beautiful wife. And I've gotten to see your kids get in on the act too this year. We've done a lot of, with your help as a partner practice, we've done a lot of virtual teaching and a lot of videos, Zoom classes, and particularly the videos. It's been fun to see your daughters participate, and they're good little chefs too. I mean, they're really doing it with the knives and everything, and getting in and sauteing, and they're very expert. So congratulations for raising two little foodies.
Yes. No, they love it. And even like on the weekends when we try to get together and cook, I mean, they're all about it, and cutting and sauteing and everything. So yeah, they love it.
That's great. Those are lessons we hope that they will take, into the rest of their lives.
Yes.
So, well, thank you so much. It's been really fun catching up, and thanks for all of the support all of these years. And we will continue to try to deliver the best nutrition information possible via our website, and now, all of the other programs that we have virtually. So I hope you'll continue to send patients to the Dr. Yum website, and even, mention some of the classes. We've been having a lot of fun with virtual classes.
Great.
Which keeps everybody safe, and we've been able to invite people from across the country to join us, which has been a lot of fun. So keep that in mind as well.
Well, good. No, once again, thank you guys for everything you guys do. It's a big service. It's a big undertaking that you guys have done. We always wish you continued success. And I look forward to seeing you guys grow as well, and everything that you guys are offering to the community.
Well, thank you. Likewise. Thanks so much for being a guest. We'll catch you again soon.
Take care.
Bye, everybody.